Hello and welcome. I'm Dr. Suhail Qureshi and I'm a senior consultant in medical oncology at Fortis Hospital, Shalimar Bagh. Breast cancer is one of the most common cancers amongst women, not only in India but also all over the world. और इस समय ब्रेस्ट कैंसर का इंसिडेंस हमारी कंट्री में एज वेल एज पूरी दुनिया में आहिस्ता आहिस्ता बढ़ रहा है. बट डू यू नो दैट almost 7 to 8 out of 10 ladies who are diagnosed with breast cancer actually detect a mass in their breast on their own by doing a self breast examination. Many of these women are able to catch breast cancer at an earlier stage just by the habit of this breast self examination, which helps us to detect breast cancer early and therefore give the chance of cure to many of such patients. तो आज के इस वीडियो में हम जानेंगे कि ब्रेस्ट सेल्फ एग्जामिनेशन क्या है और वो कैसे करना चाहिए. ब्रेस्ट सेल्फ एग्जामिनेशन इज द टेक्निक ऑफ डूइंग एग्जामिनेशन ऑफ योर ब्रेस्ट ऑन योर ओन एट रेगुलर इंटरवल्स विदाउट द इंटरवेंशन ऑफ योर डॉक्टर. दैट मीन्स कि आप अपने ब्रेस्ट को खुद एग्जामिन करें और अगर आप कोई सस्पिशियस या डाउटफुल लंप या कोई गांठ अपने ब्रेस्ट में महसूस करें, देन यू ब्रिंग इट टू द नोटिस ऑफ योर डॉक्टर एंड दैट इज व्हेन यू अंडरगो अ क्लिनिकल ब्रेस्ट एग्जामिनेशन बाय योर डॉक्टर, व्हिच मे बी योर गायनेकोलॉजिस्ट और योर ऑन्कोलॉजिस्ट. So today I'll teach you simple steps of doing breast self-examination. For doing a breast self-examination, there are few important pointers that you need to keep in mind. Number one, it must be done at regular time of the calendar. That means अगर आप प्रीमेनोपॉजल हैं, that means कि अगर आपके पीरियड्स अभी भी आते हैं तो आपको यूजुअली अपने पीरियड्स के ख़त्म होने के एक हफ्ते बाद ये एग्जामिनेशन करना है. The reason is during the periods the breasts can be heavy, they can be painful or engorged, and therefore examination of the breast may not be very comfortable at that time of the periods. On the other hand, अगर आप पोस्ट मेनोपॉजल हैं, that means आपके periods रुक चुके हैं, then the timing of breast examination is not really important. आप अपने कैलेंडर पे कोई भी एक डेट मार्क कर सकते हैं, let us say 1st of every month, and उस डेट पर आप अपना ब्रेस्ट खुद एग्जामिनेशन कर सकते हैं, बिकॉज एट दैट टाइम आपके ब्रेस्ट के अंदर साइक्लिकल चेंजेस जो कि पीरियड्स के साथ आते हैं वो आने बंद हो चुके हैं. नंबर 2, whenever you do a breast examination, you always use 3 fingers and you use the pulp of these fingers to examine the breast. आप कभी भी उंगलियों की जो edges हैं उनसे पोक नहीं करेंगे. You will use the pulp of these fingers, the flat of these 3 fingers to examine your breast in a regular manner, which I will explain to you. Number 3, ब्रेस्ट एग्जामिनेशन सिर्फ ब्रेस्ट तक सीमित नहीं होना चाहिए. इट शुड ऑल्सो इंक्लूड द आर्मपिट एंड इट शुड ऑल्सो इंक्लूड द एरिया अबव योर कॉलर बोन, जिसको हम क्लैविकल कहते हैं. सो अगर एक सिंपल भाषा में आपको याद करने का तरीका मैं बताऊं, सो रिमेंबर द A, B and C of breast self examination. A stands for armpit or axilla as it is called in the technical terms. B stands for breast and C stands for clavicle or collarbone. So breast examination is not limited to only the breast. It should include the armpit, the breast as well as area above the collarbone, which is called supraclavicular area or above the collarbone area. Number 4, ब्रेस्ट एग्जामिनेशन करने के लिए यू मस्ट इंश्योर कि आप एक ऐसे एरिया में हैं जहां आपको प्रिवेसी हो, आप अनड्रेस होकर किसी मिरर के सामने अपने आप को एग्जामिन कर सकें, अपने आप को देख सकें, एंड यू ऑलवेज शुड बी एबल टू टेक अ मेंटल नोट ऑफ द फाइंडिंग्स दैट you actually notice during that examination. So after having understood these 3 or 4 salient features, now I'll tell you the exact technique of doing a breast self-examination. So at a specified time of the calendar month, जैसे कि मैंने आपको explain किया, a lady while you are taking a shower, that is the best time to actually do this breast examination, because at that time you can undress and in your own privacy you're actually in front of a mirror and You actually stand with both your hands on your waist, just like I'm standing right now. And while standing like this, the first part of the breast self-examination means only to inspect. That means to look with your eyes. And you actually notice both the breasts, and you see in the mirror as well as from above whether you see any change in the size of the breasts, any discrepancy in the size of one breast versus the other, any skin changes, whether at all there is any discharge that you can see, any redness of the skin, any appearance of the skin where the skin may become thickened. तो कई बार ब्रेस्ट कैंसर में आपको लंप ना फील होकर, कोई गांठ फील ना होकर स्किन चेंजेस दिखते हैं. द स्किन may become red in situations where you have something known as an inflammatory breast cancer, or the skin of that area may become very thick. जैसे कि संतरे की स्किन जो होती है, संतरे का जो छिलका होता है, that has dimples over it. तो अगर कभी आपकी स्किन के ऊपर dimples पड़ने लगे, that in technical terms is called a pudgy orange appearance. That means orange peel appearance, जिसमें कि dimpling आपको अपनी स्किन पे महसूस होती है, that may be a sign of internal breast cancer. So when you stand with your both hands on your waist and you inspect both your breasts, you look for the size of the breasts, any discrepancy. You look for any obvious bulges, कि कहीं कोई गठान, कहीं कोई obvious bulge है, कहीं कोई breast के size में difference है, कोई nipple से discharge है, कोई skin changes है, and that will complete your breast inspection. The second part of your breast self-examination relates to a change in your posture. So while standing with your hands on the waist, you bend slightly forwards and you see whether both the breasts are falling equally or whether there is any nipple retraction. आपके निपल को का जो दोनों निपल्स का लेवल है वो सेम होना चाहिए. एंड व्हेन यू मूव इन फ्रंट, व्हेन यू बेंड लाइक दिस, दे शुड फॉल इक्वली. देयर शुड नॉट बी एनी रिट्रैक्शन और एनी pulling back of the skin of any one particular breast, and both the nipples should also be at the same level while you bend forwards and you look straight into the mirror. इन टेक्निक्स के बाद the next step relates to examination of the nipple and the areola. Make sure that the skin of that area is clean, while you see for any obvious discharges like a blood stained discharge that may come out from either of the nipples. After having examined yourself through the inspection, that means by just visually seeing both the breasts, the next step of breast self-examination relates to palpation. Palpation means in which you touch yourself and you look for any obvious masses, any bulges, any lumps in either of the breasts. उसके लिए position is slightly different. So to examine, let us say, the left breast, the left hand goes on the back of my head and I start palpating with 3 fingers of my right hand. So left breast के लिए you use the right hand and right breast के लिए you use the left hand. And these 3 fingers. Now focus on how I tell you to palpate yourself. So अगर हम अपने breast को एक clock की shape की form में imagine करें, so this is a 12 o'clock position, this is 3 o'clock, 6 o'clock and 9 o'clock. And if I draw a line vertically and horizontally, it divides the breast into 4 quadrants from 12 o'clock to 3 o'clock, which is called the upper outer quadrant. 3 o'clock to 6 o'clock is the lower outer quadrant. 6 o'clock to 9 o'clock is the lower inner quadrant, and 9 o'clock to 12 o'clock is the upper inner quadrant. Quadrant means 1/4. So we divide the breast into 4 equal parts, just like in a clock. So you put your left hand behind your head, and with your right hand and with these 3 fingers, you start from the 12 o'clock position, and in a circular manner, you start palpating, you start rotating your fingers in a circular manner and you start going in a clockwise manner. तो हमने 12 o'clock से शुरू किया and we are going towards 3 o'clock, then towards 6 o'clock, and by doing the same motion, I'm actually going in a clockwise manner and finishing my palpation at the same place where I actually started. This is one way of doing breast self-examination palpation. Another way is when people actually start palpating from outside and go inside towards the center, just like the spokes of a wheel. So you can start from any position. Let's say I start from 9 o'clock and I go inside. Similarly, at 10 o'clock and I go inside, 11 o'clock, 12 o'clock, and from outside I keep coming towards the center, just like the spokes of a wheel. Remember, whichever method you choose, make sure you cover the entire breast and make sure that method is used consistently by you for all subsequent examinations. That means उसी तरीके से आपको आगे भी अपने आप को एग्जामिन करना है एंड मेक श्योर कि वो तरीका यूनिफॉर्म रहे, वो बदले ना। कई बार लोग केवल 2 उंगलियों से या अपने थंब और उंगली से अगर ब्रेस्ट को ऐसे पैल्पेट करते हैं, they may falsely get the impression that they are actually palpating a lump, whereas effectively they may just be pinching the skin of that area. Similarly, after doing the examination of the breast, then you examine your armpits, your axilla. Similarly, you, with these 3 fingers, you palpate the area in the axilla, go slightly deeper in front and at the back, and you cover the whole armpit. And then after completing the examination of the armpit, then you examine the area above your collarbone and you just go across the collarbone till the area where your shoulder starts, and you make sure that there are no lumps and there are no swellings in that area as well. The same technique is then repeated on the other side. That means on the right side now. So for the examination of the right breast, I place my right hand behind my head and use my 3 fingers, and in a similar manner, whichever technique I may be comfortable with, I make sure that I complete my examination of the breast, the armpit, and then the area above the collarbone. This completes the breast self-examination. Just to recapture whatever we have learned today, we first inspect ourselves with our hands on our waist. We look for any obvious bulges, any lumps, any discharge, any skin changes, any thickening of the skin, the level of the nipple. We slightly bend forward and make sure that the breasts are falling equally. Make sure that there is no obvious retraction of the nipple. We make sure that there are no obvious lumps in the areas that I mentioned, and then we proceed to palpation part of the breast self-examination. A word of caution. Many young females जिनको periods हो रहे होते हैं, they may encounter certain lumps in their breast which may be very mobile and may move from one area to the other while they are trying to palpate the lumps. These breast lumps are sometimes benign, that means non-cancerous, and they are called fibroadenoma. And because they can be actually felt from one quadrant to the other, they can change the position. It is also known as a mouse in the breast. So these cancers, these lumps are actually not cancerous, and they are benign lumps which often can become enlarged with your menstrual cycle, and after your periods they may become smaller in size. And therefore it is very important to note any cyclical changes in the size of these lumps and report them to your doctor if at all you notice these lumps. During the process of breast self-examination, if you find any lumps, any obvious swelling in either of your breast, the next step is doing a breast examination with your doctor. And the doctor will examine your breast, which is called a clinical breast examination. After completing a clinical breast examination, if the doctor finds it necessary, then he or she may ask you to undergo a mammogram or an ultrasound of the breasts to make sure whether what you are feeling and what the doctor is feeling is actually cancerous or not, and whether that deserves or merits any further investigations and evaluations. We'll form another video for all of our viewers discussing about the role of mammography, breast ultrasound, and MRI of the breast in order to detect cancers at an early stage. Remember, breast self-examination is easy. And if at all you are able to detect cancer at an early stage, then that goes a long way in curing the patients of breast cancer. Stay tuned for more such educative videos, and please let us know your comments. We'll be happy to get back and clear any doubts that you may have. We hope that we are able to help you and educate you in the important technique of breast self-examination today. Thank you.